Hey, Dr. Jeff LaCour with Compasio Medical Education. So when a patient comes into the ER, urgent care, or primary care setting with sudden hearing loss, it's imperative that we distinguish, is this conductive hearing loss from a middle ear effusion or otitis media, or is this a nerve hearing loss, sensorineural hearing loss? So a tuning fork is an easy way to do that, and it's very cheap. Here's a 512 hertz tuning fork. What I typically do first is the Weber test. What I'll do is I'll hit it on my elbow and put it on the forehead, the nasal dorsum, or what I like to do the most of the time is have the patient open their mouth and put it on their central incisors, okay? That's where I think it's most sensitive, okay? If the patient has a middle ear effusion or otitis media on that left side, then the Weber test should lateralize to that left side, okay? If she does not have anything on that left side, but she's complaining of the left side and it lateralizes to the right, then that tells me she probably has a nerve hearing loss on this left side, and therefore it's lateralizing to her better hearing ear. All right, let's say you don't have a tuning fork and you're like, how can I tell if there's something going on? Is it conductive or nerve? Have the patient hum, okay? Let's say she has a middle ear effusion on that left side. If she hums, it should lateralize to that left side. It's just like the Weber test, okay? But let's say she comes in complaining of ear fullness pressure, and when she hums, it goes to the right side. That means it's going to her better hearing ear, and she has a nerve loss on that left side. The second test I'll use to confirm the presence of middle ear fluid or conductive hearing loss is the Rina test. What you do is you'll hit the tuning fork on your elbow and compare, is it louder in front of the ear, air conduction, or behind the ear up against the mastoid tip, bone conduction. Typically, air conduction should be louder than bone conduction, but if there's fluid present, and when I hit here and I push up against the mastoid tip, bone conduction could be louder than air conduction. If that's the case, that would confirm the presence of middle ear fluid. 32-year-old female that comes in complaining of left-sided ear pressure fullness. When I look in there, I think there might be fluid, but I want to go ahead and confirm it. So I go ahead and do the Weber test first. Please show me your teeth. And which side does that go to? Left side, okay. Why don't you go ahead and hum? Does that lateralize to either side? Left side, okay. So I'm feeling good about this. Then I do bone conduction. Is it louder number 1 or number 2?
Number 1.
Number 1. So that would confirm the presence of middle ear fluid because the Rina test also was louder behind the ear. All right, our next patient is a 23-year-old female who also comes in complaining of left-sided muffled hearing, roaring, and maybe just not quite hearing too well. So I go ahead and do the Weber test, and please show me your teeth. And which side does that lateralize to? The right side. Okay, not what I was expecting. Go ahead and hum. What side does that go to?
The right.
Okay, so she came in complaining of left-sided symptoms. Her right ear looked completely normal. It lateralized to her right, which means it's lateralizing to her better hearing ear. That tells me she has sudden nerve hearing loss on the left side, and she needs to see an ENT provider as soon as possible. If you like this content, please like, subscribe, and share to help us grow. Also, for more content like this, please check out our courses for APPs, medical residents, APP and medical students at compasiomedical.com. We'll see you there.